If you were to experience heart failure, the decision to ride in an ambulance could be between life and death. Some of those around us have no liberty to make that choice. For them, the decision remains between debt and death. Should our main purpose in providing health care for the citizens of our country be funding the institutions long established and lining the pockets of large corporations, or simplifying the process for medical care and reducing costs for our citizens? Being a student from a Title I high school in rural Mississippi, I've seen my peers make hard decisions between nutritious food or essential medical care. Because of my father's diagnosis and treatment for colon cancer, I've lived through that same trial. In addition to this, I've researched the current state of countries with similar proposed policies, and I've researched the implementation barriers for the United States. In this speech, I'll explain how the privatization of healthcare lacks the access to essential medical care for many citizens, which results in a need for a more accommodating medical system. I'll present a plan for implementation and possible financial solutions to subsidize costs, which would satisfy the need for a better system. And lastly, I will exhibit the benefits of my proposed solution to persuade you to support a more equitable healthcare system in the United States. As healthcare becomes a more private and less governmentally overseen industry, companies become more comfortable with profiting off of citizens who cannot afford to undergo life-saving treatments. The United Nations has designated developmental goals that should be solved before our nation's societies can truly be harmonious. Maria Gall's article entitled High-Quality Universal Public Healthcare, Beneficial for Patients and Much More, published in the European Journal of Preventive Cardiology, states that universal healthcare is part of the United Nations Sustainable Developmental Goals number 3, good health and well-being, which includes the achievement of universal health coverage and access to quality essential healthcare services. In addition, a direct link can be made to goal number 10, reducing inequalities. Ensuring that no one is left behind requires universal policies paying attention to the needs of disadvantaged and marginalized populations. Here we can see that the biggest problems associated with privatized healthcare is that it can often create a more profit-focused industry. It can disregard human rights. It can often cut corners and costs. It can be responsible for insider deals and trading. And lastly, it can offer a high barrier of entry for basic care. No system is perfect, but gradual reform and evidence-based implementation can produce the most equitable outcomes. This argument is made clear in Universal Healthcare in the United States of America, A Healthy Debate, by Gabriel Ziff et al., published in Medicina, when stating, non-inclusive, inequitable systems that limit healthcare quality, access to those who can afford it, or have an employer-sponsored insurance. These policies exacerbate health disparities by failing to prioritize preventative measures at the environmental, policy, and individual level. Failing to prioritize comprehensive, affordable health care for all members of society and straying further from prevention will harm the health and economy of the U.S. While there are undoubtedly great economic costs associated with universal health care in the U.S., we argue that in the long run, these costs will be worthwhile and will eventually be offset by a healthier populace whose health is less economically burdensome. So in a nation where trillions of dollars are spent on healthcare every year, there is a way to accommodate the basic needs of every citizen. Our current system lacks the amount of people given benefits and encourages corporations to spend their excess money on worker benefits. For example, in Shouldn't the Private Sector Be Solving the Healthcare Problem by William Sharkley, published in Financial Executive, it is stated that last year AT&T paid roughly $3 billion in today's money in health costs for its 300,000 employees. General Electric paid $950 million, over $2.6 billion in today's money, in 1988 for employee health coverage, 17% more than in 1987. And GE expected its annual health costs to rise by 20% in 1989, an annual jump of roughly $200 million. Corporate healthcare expenses rise not due to sticker prices, but due to profit-driven systems that resist meaningful reform. For example, one implementation method described by Saab Kabi et al. In Public and Private Healthcare Systems in terms of both quality and cost, a review, published in the Journal of Clinical and Diagnostic Research, is found after acknowledging that also private health insurance may present significant equality challenges, potentially increasing healthcare spending. Complete coverage of the public sector costs by private insurance may encourage more hazardous-induced utilization. Hence, considering the ethical issues involved in a for-profit healthcare system and the drawbacks of private insurers, health insurance must be administered by nonprofit organizations. Often the notion of free universal health care is overestimated. It's reasonable to set limits on the type of care that are covered. As stated in the book, Would Democratic Socialism Be Better by Lane Kenworthy, published by Oxford University Press, The care available to people should include effective prevention, diagnosis, and treatment. This doesn't mean that everyone should have immediate access to every treatment or every type of medication for as long as non-emergency diagnosis and treatment persists. It's appropriate to ask people to pay out of pocket to purchase separate insurance if they wish to have extras covered, or if they want to minimize wait times or maximize choice of provider. My proposed solution would follow these 10 steps. Firstly, expand the Center for Medicaid and Medicare Services to maintain proper fund distribution amongst all citizens. 2, expand the rights of the Food and Drug Administration to oversee pharmaceutical pricing. 3, allow pharmaceutical companies to still produce medicine, but at a much lower rate as mandated by law. 4, make advertisement of pharmaceuticals illegal. 5, tax elective surgeries or extra insurances. 6, tax large corporations for individuals that work for them. 7, limit funding for keeping small rural clinics and hospitals open. 8, allow states to assign citizens to various regional general care facilities based on geographic location and capacity. 9, pay facilities based on the number of patients seen yearly. And 10, subsidize only essential care, preventative medical education, and required surgeries. Lastly, the implementation of more equitable and publicly guided healthcare systems would not only improve the health outcomes of millions of Americans, but would also contribute to a more stable economy. As the financial burden of the medical expenses decreases, citizens can redirect that unused income toward housing, education, and local economies, strengthening communities from the ground up. Furthermore, fewer families would face bankruptcy or long-term debt due to medical emergencies, directly improving national economic productivity and morale. With a reduction in private control and profit-driven motives, healthcare providers would be able to shift their focus from revenue-based performance to patient-centered care. This would promote a medical culture that values compassion, ethical treatment, and long-term wellness over financial gain. In turn, this shift would likely reduce burnout among healthcare workers, as they would be allowed to prioritize patient health rather than institutional quotas or insurance restrictions. Finally, the adoption of a subsidized universal healthcare model would fulfill our moral obligation to ensure that no citizen is left behind due to circumstances beyond their control. The current medical system utilized by the United States prioritizes tradition and ease over improving the health of our nation's 331.4 million people. Many solutions have been presented to combat the negative effects of our current private system, like transitioning to a wholly nonprofit medical system. However, the only solution forward is to create a system in which all citizens are afforded the right and basic human right, which will allow citizens to redistribute their funds, not spent on their own care, but into stimulating their local economies. By prioritizing health over profit and equality over exclusivity, we can envision a system that not only meets the needs of every citizen, but also strengthens the morale and economic fabric of our own nation. Thank you.